Hello everyone, my name is Jonathan Rosenthal. I'm a resident physician in New York City going into neurology, and I've also been teaching yoga for about 7 years. I'd like to tell you a little bit about how yoga affects the nervous system according to the scientific literature and with particular attention to stress, anxiety, and depression.
I want to start with an overview of brief neuroanatomy, particularly focusing on the peripheral nervous system. More specifically, looking at the involuntary branch of the peripheral nervous system called the autonomic nervous system. This controls all of the subconscious processes going on in our body, like digestion, blood pressure, and it has two parts, two wings: the parasympathetic, or the rest and digest system, and the sympathetic, the fight or flight system. We can measure how active these systems are with something actually quite simple called heart rate variability. And this works because the parasympathetic nervous system slows down the heart and the sympathetic nervous system speeds it up. In this live recording, you can see as the breath is inhaled starting now, the heart rate starts to speed up. And then during exhalation, it slows down. One way to think about heart rate variability is that the more the difference between the inhalation heart rate and the exhalation heart rate, the more parasympathetic nervous system activity there is, and so more rest and digest. And heart rate variability matters because it is associated with our topic for today: stress, anxiety, and depression. In this study, patients with major depressive disorder had lower heart rate variability, meaning more sympathetic over parasympathetic activity. In other words, more fight or flight over rest and digest. So what happens to heart rate variability when yoga is used as an intervention, in this case in pregnant women? Not only does perceived or subjective stress decrease, but there is a measurable increase in heart rate variability, and thus we infer parasympathetic nervous system activity. This reflects an increase in the rest and digest component of the nervous system. In another study in college students, participants practiced either fast or slow breathing before awaiting an electric shock. Can you imagine? And those who practiced slow breathing had less of a decrease in parasympathetic tone, suggesting that these meditative practices are even protective for future stressors.
So now I would like to show you a simple breathing exercise that can be done anywhere called square breathing. It's called square because it is in for 4, hold for 4, out for 4, hold with the breath out for 4. So 4, 4, 4, 4. Let's give it a try. Sitting up nice and tall, we'll just do 3 rounds. Shoulders back, eyes closed, and exhale completely. Let's begin. In, 2, 3, 4. Hold. 2, 3, 4. Out. 2, 3, 4. Hold with the breath out. 2, 3, 4. In. Hold. Out. Hold. In. Hold. Out. Hold. Resume normal breathing, keeping the eyes closed. 2 breaths. And slowly opening the eyes.
So, to summarize, stress, anxiety, and depression have the effect of activating the fight or flight branch of the nervous system, called the sympathetic nervous system. And yoga counters this and also protects against future insults by increasing the activity of the parasympathetic nervous system, the rest and digest branch. If you'd like to learn more, please follow us. You can find us on Instagram at NeuroYogaNYC, as well as join our mailing list by emailing neuroyoganyc@gmail.com. Thank you so much for listening.